We're seeing a severe shortage right now of blood, and that's really due to an unprecedented number of blood drive cancellations due to coronavirus related concerns. So, if you think about where a lot of our blood drives normally are, they're at places like schools and colleges, businesses, things that have gone remote, since this program began, or since this virus began. And so that's led to an unprecedented number of cancellations. Across the country, we've seen over 7,000 Red Cross blood drives canceled. That's led to about 200,000 less or 200,000 fewer blood donations that we've been able to collect since the pandemic began. And so that's as a nation, the Red Cross collects about 13,000 units of blood a day in order to meet the needs of hospitals across the country. So that's over 10 days worth of blood that has gone uncollected due to the coronavirus pandemic.
So what are you asking residents to do now that it seems like everybody's home and we're all trying to take good social distancing precautions?
Yeah, so blood collection and blood support and the blood supply has been deemed one of those essential services. So while, as you can see, I'm working from home, our blood collection folks are still working in the fixed sites in our facilities. They're keeping as many drives as we can keep open. So what we're really encouraging any healthy, eligible individual to do is make an appointment now to make that gift of life-saving blood, make that donation at some point in the days and weeks to come. We've seen such a great outpouring since this began and since we started talking about this severe shortage that we've had that, we're really seeing almost an influx of people at the drives that are still existing as so many have been canceled. So we're really strongly encouraging people to make an appointment, both for some of that social distancing that we're talking about in order to help us manage the flow of people in a safe fashion. But also because we don't want them to get discouraged. If they go online, if they go on our donor app and they can't find an appointment right now, don't get discouraged because this is going to be an ongoing thing. Blood has a shelf life. Whole blood can last about 40 days. Platelets only last about 5 days. And so this is going to be an ongoing need. The need for blood is constant anyways. Of course, unfortunately, it appears as though we're going to be dealing with coronavirus for the days, months, weeks, and months ahead. And so we're going to need blood donors in the days, weeks, and months ahead in order to ensure that patients in the hospital have that life-saving blood that they rely on.
Now, what kind of steps have been put into place to ease the fears of folks who go there? Is the process a little different than it normally is? How are we trying to abide by those social distancing rules?
Yeah, so we understand that people may have a little bit of a hesitation. The first thing we want to emphasize is that it is a safe process for both the donor and the recipient, that there have been no reported cases, no evidence of any respiratory virus, which is what the coronavirus is, being transmitted through a blood transfusion. In addition to some of the health and safety steps that we take in testing that we do on an ordinary basis, we have instituted some extra steps as a result of the coronavirus concerns. I actually donated at our facility in Cheektowaga on last week. And so I can speak to these. They happened. We're taking the temperature of everyone who enters the blood center before they enter to make sure they're healthy. And if they do have a fever, they're not allowed to enter. We're doing that outside the door. While they're doing that, they're going to put some hand sanitizer in your hand. And that's going to be available throughout the process. They're wiping down the beds and the other donor-facing things that donors may touch more regularly than they already do in order to ensure the safety. And, we talked about that social distancing. Wherever possible, we're doing bed spacing. We're spreading the beds out as far apart as we can, and trying to get that minimum of 6 feet so that we can honor that distance between the blood donors themselves.
All right. Yeah, perfect. And then here locally in the Jamestown area, what's the best way for people to find sites to donate blood?
Yeah, the best thing to do is to go to our website, redcrossblood.org, or donate our free blood donor app. Put in your zip code and it'll find upcoming drives in your area. And again, we want to emphasize that this is a marathon, not a sprint, that the need for blood is going to continue in the days, weeks, and months ahead. Even someone like me who donated last week, I can't donate for another 50 plus days after my donation. And so you can see that that gap is going to be there. So even if you can't go immediately, please make that appointment. Again, redcrossblood.org or free blood donor app. You can also call 1-800-RED Cross and try and make that appointment in the days and weeks to come to really help the patients in need at area hospitals.